When people hear the term robotic surgery, they often imagine a robot performing the operation independently. In reality, robotic surgery simply means that I use highly advanced technology, in this case the MAKO robotic system, to assist in performing your joint replacement with even greater accuracy and precision. The MAKO system starts with a detailed 3D scan of your joint. This allows us to create a personalised surgical plan tailored to your anatomy. During surgery, the robotic arm helps guide the placement of the implants to within fractions of a millimetre of the planned position. The key point is that the robot doesn't replace the surgeon. It enhances the surgeon's ability to execute a customised plan precisely. I'm in full control at all times, but the technology provides real-time feedback, ensuring that bone preparation stays within the safe boundaries we've mapped out. I use robotics because precision matters. Accurate implant positioning can help improve the feel and movement of your new joint, and it may reduce the risk of uneven wear, instability, or even the need for revision in the future. Many patients also experience less soft tissue trauma, less pain in the early recovery phase, and a faster return to activity. Ultimately, robotic-assisted surgery is about combining surgical expertise with the best technology available, giving patients the most reliable and individualised outcome possible.
Dr. Danny Awwad is an orthopaedic surgeon with Adelaide Orthopaedic Specialists. He consults and operates at Flinders Private, Ashford and Western Hospitals. For appointments, call 08 8267 8286 or email drdannyadmin@aos.com.au.